Question 77. The nurse is teaching a client who has iron deficiency anemia about foods she should include in her diet. The nurse determines that the client understands the dietary modifications if she selects which of the following from her menu? A. Nuts and milk. B. Coffee and tea. C. Cooked rolled oats and fish. D. Oranges and dark green leafy vegetables. Correct answer. D. Dark green leafy vegetables are a good source of iron and oranges are a good source of vitamin C, which enhances iron absorption. All other options are not food sources that are high in iron and vitamin C. Question 78. A nurse is planning to teach a client with malabsorption syndrome about the necessity of following a low-fat diet. The nurse develops a list of high-fat foods to avoid, and includes which food item on the list? A. Oranges. B. Broccoli. C. Cream cheese. D. Broiled haddock. Correct answer. C. Fruits and vegetables tend to be lower in fat because they do not come from animal sources. Broiled haddock is also naturally lower in fat. Cream cheese is a high-fat food. Question 79. The nurse instructs a client with renal failure, who is receiving hemodialysis about dietary modifications. The nurse determines that the client understands these dietary modifications if the client selects which items from the dietary menu? A. Cream of wheat, blueberries, coffee. B. Sausage and eggs, banana, orange juice. C. Bacon, cantaloupe melon, tomato juice. D. Cured pork, grits, strawberries, orange juice. Correct answer. A. The diet for a client with renal failure who is receiving hemodialysis should include controlled amounts of sodium, phosphorus, calcium, potassium, and fluids. The food items in options 2, 3, and 4 are high in sodium, phosphorus, or potassium. Question 80. The nurse is conducting a dietary assessment on a client who is on a vegan diet. The nurse provides dietary teaching, focusing on foods high in which vitamin that may be lacking in a vegan diet. A. Vitamin A, B. Vitamin B12. C. Vitamin C, D. Vitamin E. Correct answer. B. Vegans do not consume any animal products. Vitamin B12 is found in animal products and therefore would most likely be lacking in a vegan diet. Vitamins A, C, and E are found in fresh fruits and vegetables, which are consumed in a vegan diet. Question 81. A client with hypertension has been told to maintain a diet low in sodium. A nurse who is teaching this client about foods that are allowed includes which food item in a list provided to the client? A. Tomato soup. B. Boiled shrimp. C. Instant oatmeal. D. Summer squash. Correct answer. D. Foods that are lower in sodium include fruits and vegetables, option 4, because they do not contain physiological saline. Highly processed or refined foods, options 1 and 3, are higher in sodium unless their food labels specifically state low sodium. Saltwater fish and shellfish are high in sodium. Question 82. A nurse is caring for a client with cirrhosis of the liver. To minimize the effects of the disorder, the nurse teaches the client about foods that are high in thiamine. The nurse determines that the client has the best understanding of the dietary measures to follow if the client states an intention to increase the intake of A. Pork, B. Milk, C. Chicken, D. Broccoli. Correct answer: A. The client with cirrhosis needs to consume foods high in thiamine. Thiamine is present in a variety of foods of plant and animal origin. Pork products are especially rich in this vitamin. Other good food sources include nuts, whole grain cereals, and legumes. Milk contains vitamins A, D, and B2. Poultry contains niacin. Broccoli contains vitamins C, E, and K and folic acid. Question 83. The nurse is instructing a client with hypertension on the importance of choosing foods low in sodium. The nurse should teach the client to limit which of the following foods? A. Apples, B. Bananas, C. Smoked sausage, D. Steamed vegetables. Correct answer: C. Smoked foods are high in sodium. Options 1, 2, and 4 are fruits and vegetables that are low in sodium. Question 84. A client who is recovering from surgery has been advanced from a clear liquid diet to a full liquid diet. The client is looking forward to the diet change because he has been bored with the clear liquid diet. The nurse would offer which full liquid item to the client? A. Tea, B. Gelatin, C. Custard, D. Popsicle. Correct answer: C. Full liquid food items include items such as plain ice cream, sherbet, breakfast drinks, milk, pudding, and custard, soups that are strained, refined cooked cereals, and strained vegetable juices. A clear liquid diet consists of foods that are relatively transparent. The food items in options 1, 2, and 4 are clear liquids. Question 85. A client is recovering from abdominal surgery and has a large abdominal wound. A nurse encourages the client to eat which food item that is naturally high in vitamin C to promote wound healing? A. Milk, B. Oranges, C. Bananas, D. Chicken. Correct answer: B. Citrus fruits and juices are especially high in vitamin C. Bananas are high in potassium. Meats and dairy products are two food groups that are high in the B vitamins. Question 86. A postoperative client has been placed on a clear liquid diet. The nurse provides the client with which items that are allowed to be consumed on this diet. Select all that apply. 1. Broth, 2. Coffee, 3. Gelatin, 4. pudding. 5. Vegetable juice. 6. Pureed vegetables. Correct answer. 1, 2, 3. A clear liquid diet consists of foods that are relatively transparent to light and are clear and liquid at room and body temperature. These foods include items such as water, bouillon, clear broth, carbonated beverages, gelatin, hard candy, lemonade, popsicles, and regular or decaffeinated coffee or tea. The incorrect food items are items that are allowed on a full liquid diet.